Good morning. I am Dr. Ravi Ramalingkam, Senior ENT Consultant at the KKR ENT Hospital and Research Institute in Keelpok, Chennai. Today I am going to be speaking to you about the growing problem of snoring and the associated sleep apnea syndrome. In our city, not only in our city, in all major metros in our country especially, the problem of lifestyle problems is becoming more and more. People are becoming more sedentary, more obese, and lifestyle diseases such as obesity, hypertension are all on the increase. Along with these problems, the problem of snoring is also becoming a major problem today. It is estimated that the number of people who suffer from heavy snoring and associated obstructive sleep apnea is more than 5% of the population. The problem is that most of the time, good snoring or heavy snoring is associated with a good quality of sleep. Nothing could be further from the truth. When somebody snores heavily, it means that there is a block to the flow of air anywhere from the nose to the chest. This block could be in the nose, it could be in the throat, that is the palate, or even lower down in the tongue or in the larynx. So any of these areas causes an obstruction to the flow of air, and this disturbed flow of air when the air goes in is what manifests as snoring. Now, a large number of people, especially in the older years, snore. Do all of them have a problem? No. It is estimated that about 30% of women and about 50% of men in the range of 50 years and above will snore. That is not a problem. But when is it a problem? When the patient has the following symptoms. One, it is called heroic snoring. Heroic snoring, there's nothing heroic about it, it's just a word for it. It means that the snoring is so loud that if you sleep in an enclosed room, the snoring can be heard outside. That is heroic snoring. Now, because of the disordered flow of air during sleep, the patient does not get a good quality of sleep and consequently feels dull and drowsy in the next day. The whole day he feels dull and drowsy. That is called excessive daytime somnolence or sleepiness. The other things are associated in terms of problems like diabetes, problems of heart, problems of blood pressure. All of these manifest together. But the most important thing to look out for is extremely loud snoring and sleepiness in the daytime. Another problem is that they have what is called obstructive sleep apnea. What is apnea? Apnea is actually a stoppage of breathing during sleep. This is not seen by the patient because the patient is fast asleep. This is noticed by the wife or the partner of the patient, who notices that during the breathing process the snoring is loud and suddenly silence. Stopping of breathing for more than 10 seconds constitutes an apneic episode, and in these patients with severe snoring and sleep apnea, this kind of stopping of breathing could extend for periods of 30 seconds or more. This forms the basic pattern and symptoms of patients who have snoring and sleep apnea syndrome. Like I said before, this is often accompanied with lifestyle problems of obesity, lack of physical activity, and then problems of diabetes and hypertension. So when we in the KKR ENT hospital, and especially now the newly established KKR ENT sleep clinic, when we see a patient who comes in, we investigate them by doing a few tests. The most important tests relevant for sleep and snoring would be what is called a polysomnography or a sleep study. The patient comes to the hospital, sleeps in the hospital overnight with the machine, the monitor attached to them. It looks like a small phone and it has a couple of wires attached to the body, and this sleep study will tell you how much of snoring, how much of breathing problems, in the meaning that how much of oxygen level in the body comes down as a result of this snoring, how many times in the night has there been a block to the flow of air. Along with this, numerous other parameters are got from this valuable test. The second test is what is called sleep endoscopy. The polysomnography or the sleep study will tell us how bad the problem is, and the sleep endoscopy, which involves putting a tube into the nose all the way down to see where the block is, tells us where exactly the block is. Depending on these two reports, we can plan the treatment. The treatment could be, there's no medicine. Lifestyle changes are important. You have to lose weight, you have to exercise, you have to control your diabetes, you must control your blood pressure. Specifically for snoring, you have two treatments. One is an operation done inside the nose and the throat to cut away and remove the obstructing tissues so the breathing is better. Sometimes if the problem is severe, instead of an operation, we offer something called a CPAP, continuous positive airway pressure, a small machine which the patient has to wear when they sleep at night. Whatever the treatment is, what is important to know that the result of this kind of treatment for snoring is very good. It is therefore imperative that somebody with heavy snoring and blocking of breathing during sleep seeks medical help and sees an ENT surgeon. The results are good, getting better, and will definitely make a big quality improvement in the patient's life. Thank you so much.